Welcome to this eye-opening video on a topic surrounded by myths. Does masturbation protect or destroy the prostate? Millions of men worldwide have this question. Some believe frequent masturbation weakens the body. Others say it actually protects the prostate from cancer. So what is the truth? Today, we'll uncover the science, the studies, and the facts. 8. Watch till the end, because the answer may surprise you. The prostate is a small gland shaped like a walnut. It sits just below the bladder and surrounds the urethra. Its main role is to produce fluid that mixes with sperm. This fluid nourishes and protects sperm during ejaculation. The prostate also plays a role in hormone balance. However, it is prone to infections, enlargement, and cancer. That's why keeping it healthy is important for every man. For centuries, masturbation was considered harmful. Old myths claimed it causes weakness and even blindness. Religious and cultural beliefs made it a taboo subject. But modern science has a completely different view. Research now shows masturbation is a natural sexual activity. It has both psychological and physical benefits. But does it specifically help or harm the prostate? Let's dig deeper into scientific studies. In 2016, Harvard researchers studied 30 Zen men. They found men who ejaculated more than 21 times a month had a lower risk of prostate cancer. Another Australian study found similar results. Regular ejaculation seems to flush out harmful substances. These toxins could otherwise build up in the prostate. The studies concluded frequent ejaculation may be protective, but the results also vary with age. Let's explore that next. Age plays an important role in prostate health. In younger men, the link between masturbation and cancer risk is less clear. One early study suggested frequent sex in young men may increase risk, but later, larger studies did not confirm this. For men in their 50s and older, masturbation appears more protective. Therefore, the age factor must be considered. Masturbation is not a one-size-fits-all solution. Other lifestyle factors also matter a lot. Scientists have proposed several theories. The flushing theory says ejaculation clears toxins from the prostate. It removes harmful substances that could cause cell damage. Ejaculation also reduces inflammation in prostate tissue. It improves blood flow in the pelvic region. This keeps the gland healthy and active. Therefore, 8. Page 7. Masturbation isn't just about physical health. It reduces stress and anxiety. Orgasms release feel-good hormones like dopamine and oxytocin. These hormones improve mood and sleep. A healthy mind supports a healthy body. Stress is known to worsen inflammation in many organs. Therefore, mental relaxation indirectly benefits the prostate. Balanced sexual activity contributes to overall well-being. Some studies examined masturbation after prostate surgery. Men who resumed sexual activity earlier recovered faster. They regained erections and urinary control sooner. This suggests masturbation may aid rehabilitation. It keeps pelvic muscles active and blood circulating. However, such recovery must be guided by doctors. It's not a replacement for medical treatment, but it shows the prostate responds positively to activity. Risks. Are there any? So far, no evidence shows masturbation harms the prostate. It does not cause cancer or permanent damage, however, may cause temporary soreness. It can also lead to psychological guilt if done with stress. A rare condition called PHYCHOLOGY causes flu-like symptoms after orgasm. In general, masturbation is safe when practiced moderately. The key word is balance. Myths versus facts. 1. Myth. Masturbation causes infertility. Fact, it does not. Sperm is constantly produced. Myth: it leads to erectile dysfunction. Fact: no evidence supports this. ED is usually due to other factors. Myth: it weakens the body. Fact: normal masturbation has no weakening effect. Myth: it increases prostate cancer risk. Fact: most research shows it reduces the risk. How often is healthy? Now the big question: how often should you masturbate? Science doesn't give an exact number for everyone. The Harvard study showed benefits at 21 times per month. That's roughly 4 to 5 times a week. But your body's needs may be different. Listen to your body and avoid overdoing it. Too much can cause fatigue or irritation. Moderation is the key to prostate-friendly habits. Masturbation versus some wonder: is sex better than masturbation for the prostate? Both involve ejaculation, so both provide similar benefits. However, sex also releases extra bonding hormones. It strengthens emotional connections with a partner. Masturbation is a safe alternative when sex isn't possible. It offers the same cleansing effect for the prostate. The choice depends on personal lifestyle. Both can be healthy when practiced responsibly. Lifestyle factors matter. Masturbation is just one piece of the puzzle. Diet, exercise, eating vegetables and nuts lowers risk. Avoiding smoking and reducing alcohol helps too. Staying active improves blood flow and hormone balance. Managing weight is critical to reducing cancer risk. A healthy lifestyle supports a healthy prostate. Combine good habits with balanced sexual activity. When masturbation might not help, masturbation is not a cure for all prostate issues. If you have chronic pain or swelling, seek medical help. Conditions like prostatitis need proper treatment. Delaying medical care can worsen the problem. Do not rely only on self-care for serious symptoms. A doctor's diagnosis is essential in such cases. Masturbation may help. Always consult a urologist if symptoms persist. The role of prostate screening. After age 40, prostate screening becomes important. Tests like PSA can detect early signs of cancer. Early detection saves lives. Do not skip regular checkups if you are at risk. Men with a family history should be extra cautious. Combine screening with healthy sexual activity. Masturbation is preventive. 8. Stay informed and proactive about your health. Cultural taboos and mental health. 1. In many cultures, masturbation is still considered shameful. This guilt can harm mental health. Science proves it's a normal. Breaking myths is essential for men's wellness. Education helps remove unnecessary fear. A healthy mind accepts natural body functions. There is nothing to be ashamed of. Knowledge is power. Share it with others. Apart from ejaculation, other habits protect the prostate. Regular exercise reduces inflammation and improves circulation. Staying hydrated keeps urine flow healthy. Avoid sitting for very long hours. Move around often. Reduce intake of processed foods and red meat. Include zinc and omega-3 rich foods in your diet. Good sleep and stress control are equally important. Prostate health is a combination of many factors. Most urologists agree masturbation is safe. They often recommend regular ejaculation for prostate health. Doctors emphasize balance, not excess. They warn against ignoring symptoms like pain or blood in urine. Medical advice is always the final word. Do not rely on myths or internet rumors. Trust science and consult professionals when needed. Your prostate deserves expert care. After reviewing all the studies, masturbation does not destroy the prostate. It likely protects it by flushing out harmful substances. It may lower the risk of prostate cancer. It supports both mental and physical health. The only caution is moderation and awareness. Combine it with a healthy lifestyle and regular checkups. Science supports masturbation as a positive practice for prostate health. So it protects. There is no need to feel guilty or ashamed. Your health is in your hands, literally and figuratively. Take care of your body. Spread this knowledge to break the myths around men's health. Stay educated and stay confident. Thank you for watching. See you in the next video.